Hello care leaders. My guest today is Sue Sheath, and today we're going to talk about Barchester's experience of undergoing 15 CQC assessments. For those of you who don't know Sue, she's the Director of Regulation and Quality Improvement at Barchester Healthcare, and when Sue joined in 2014, Barchester's good and outstanding ratings sat at around 40%. Now they're just shy of 90, so good on Sue. Sue served as head of regional compliance for the CQC before joining Barchester around 10 years ago. And an interesting fact about Sue is that she can speak French. Important things that you can expect to learn from this episode include why you shouldn't be worried about your next CQC assessment, what you should be focused on to improve your ratings, why the single assessment framework isn't sustainable and what needs to be done to change, and how to support your team during any upcoming assessments, and much, much more. My name is Simon Parker, and this is the Care Leaders Network podcast. So, without further ado, please welcome Sue Sheath. What can care leaders expect from their next inspection or assessment?
I think that's a really interesting question because actually every one of our 15 assessments has been different.
Okay.
So I'm hoping that will get more consistent as things go on. But I think it's important to be ready at any time because you don't know when they're going to arrive. It's important to remember that they start the assessment before they actually turn up on site. So it may be in some circumstances that you're asked for information before they turn up. And that's definitely happened, not with us, but with other providers. And I think on the day, it's obviously welcoming them and making sure that you're clear at the start what exactly it is they're going to be looking at. So it's absolutely fine to ask people, ask inspectors what quality statements they're looking at and try and get a sense of why they've come in, because sometimes they'll be coming in on a risk basis. Other times they're just coming in to review the rating. So I think first thing, relax, welcome them. Take the opportunity to show them around if you get that chance. And we're certainly seeing a much more relaxed approach from inspectors who are doing some more different approaches to the assessments currently. And I think it's making sure that you're available, check in with them during the day, but recognise the fact that the purpose really on site is to talk to people, is to observe practice. So they won't necessarily be looking at a lot of documents. They're starting to do a bit more of that, but what you can expect is that they will ask you for a list of documents afterwards. Some of those lists have been quite extensive, but others have been a lot shorter. And expect also that they may not speak to everybody on the day. They'll want to speak to residents and patients, depending on your service. They will want to talk to staff. But what we've found is that people don't always get spoken to on the day. And what they want is a list of people's names and contact details to be able to speak to them after the event. And it's really important that obviously you seek consent for that and prepare for it. And then be prepared for a bit of a wait once the inspections happen, the on-site visits happen, because quite often these have gone on for weeks and sometimes months. Hopefully it's going to speed up. But certainly that can be the timescales that it takes to get that conclusion reached. And then you get your draft report and you're able to comment on that as you see fit. Sure.
Yeah, no, that makes sense. Really interesting point that you brought up there, just about the fact that although you've got probably the most number of inspections in the country, certainly within the care sector by the sounds of things, the fact that there seems to be a lack of consistency around what the experience actually was. Are you expecting that over a period of time as the kind of the data set, if you like, grows? Are you expecting to start to see trends, or are you envisaging a world whereby it is just going to be different every single time?
I think at the moment it's been that settling down process. And I think there's been a lot of turmoil. There's been a lot of change. I think it's taken a while for inspectors to get used to the framework. And there is probably more change to come. So it's probably difficult to say it's going to be consistent for some time yet. And as you know, there's been various reviews going on and it'll be interesting to see how they pan out. But I think that hopefully inspectors are feeling supported in what they're doing in order to do a great job on the ground. And what they want to do when they come in is to see the service, assess it properly, and form a judgment. And I think it's important that they've got good guidance to support that, but also that providers know what to expect. And I think that's the bit that's lacking at the moment. There is work going on to try and address some guidance for providers, and I've been involved in talking to CQC about that. So I think that will help everybody prepare, know what to expect, and look for the consistency that we all want. It's always challenging when you're looking for consistency over a country. You've got lots of inspectors, you've got lots of different services, and at the end of the day, we're all human beings, and so no one day is the same in social care anyway.
Of course.
But it's about making sure that we all get a fair assessment, and the inspectors are equipped to do that. So hopefully that will come over time.
Am I right in saying that because traditionally before the single assessment framework, there was always a PIR that went in, the request for the information and things like that, and that was almost a precursor to the inspection. How has that evolved? Am I right in saying that that's now not part of the process, so that it's you don't have that heads up, whereas before you would have?
Yeah, that's correct. In fact, what's happening with PIR, provider information return, which is your own assessment really to provide information to CQC, they now send that out on the anniversary of your registration date. So actually, it's just an annual thing that goes out and there's no indication they're coming. They will use that information as part of their intelligence gathering. So if they see something they think is different or concerning, that may well form part of their assessment of when to come in and do an inspection. But no, you're right, it's no trigger particularly for an assessment right now.
Sure, because that always used to be okay, we've really got to make sure that we've got our I's dotted and our T's crossed set of circumstances. Of course, they've removed that, which the pros and cons, I guess, of the different set of circumstances. So I guess that there's an example of something that's quite different to the way that it was before. What would you say the key big differences that you've seen as a result of the inspections that you've overseen so far?
I think obviously there is a new framework. There's no change to the regulations, but it is about the way in which the assessment is conducted. So at the moment, as it stands, there's somebody behind the scenes looking at the intelligence that they gather, using all the information they've got, putting that together and deciding what they're going to look at based on that. There has been a lot of focus on risk in previous years, and I think that's still the case. I think CQC is always worried about missing something. But equally, we want them to come in and look at a service just because it could be good moving to outstanding. So it's about achieving that balance that we're all looking for. I think also the quality statements are different to what we had before from the key lines of inquiry. And so they're working through all of that to try and assess things slightly differently. But there is talk of moving back to some of the way things were going. I mean, the other thing I think is interesting is there's a scoring system at the moment. So the evidence categories, the quality statements are all scored and they calculate a rating. That is under review, and we've heard changes for that coming, so that they don't just focus on scoring. That has made things a little more complicated for people to understand. I think actually the scoring is quite interesting because what it does do is it gives you an indication of how close you are to the boundaries of the key question rating. So how close are you to requires improvement? Equally, how close are you to outstanding? So I think it'll be a shame if that gets lost completely, but there is talk of reviewing that too. So a few changes, but fundamentally the regulations remain. At the end of the day, we work to regulations.
That was one of the things, I guess, with the key lines of inquiry. Of course, you've got literally a key line of inquiry. If you wanted to be really diligent, you'd go and hit absolutely every single one of those things and make sure that you could document and evidence everything in regards to the each one of the Chloes. Different world, different sets of circumstances. Of course, I can certainly see the appeal of being able to be very specific around what do we need to be able to do to be recognised as good, outstanding, whatever the set of circumstances might be. So, I guess the new approach does throw a little bit of a curveball in that regard. But there's, as we sat here today, the most recent reports come out this morning, or is it later on today that it's come out? I haven't kept on top of that one, but obviously there's quite a lot of choose my words carefully. There's been quite a lot going on with the CQC at the moment, both in the context of the inspection in regards to the leadership, how they conduct themselves and deliver the actual inspections or assessments themselves now. Talk to me a little bit about that landscape, if you like.
Yeah, sure. So today's the day that the Dr. Penny Dash review is due to report. It wasn't out when I left this morning. But also what CQC has published is a review that's been conducted by Sir Mike Richards, who used to work as a chief inspector at CQC. And he's been doing an internal review and supported also by the Care Provider Alliance, who are doing some additional work, particularly on the social care side of things. So you're right, the landscape is really interesting right now. I've been working with CQC for a number of months now to sort of talk to them about what we as providers see and feel and want to see happen with the framework. So yeah, it's a very interesting picture right now. Things are changing. I think we're going to see a lot of change over the next few months. There's a new chief executive just been appointed at CQC. So I think that's a welcome opportunity to see some change. I think that the single assessment framework, the intention was absolutely right. Unfortunately, the execution hasn't been so great. And I think that's where it's been challenging, but I'm hoping that with the feedback that we've provided from the sector, that CQC are working towards improving on that. And I think their own staff have also felt the same concerns that we've had around it. But I think, we look to the future now. Hopefully things will change. And I think it'd be a shame to throw it all out. There are some elements that could work really well if they were just executed slightly differently. And I think the important thing at the end of the day is we all need good regulation.
Of course.
I used to work for the regulator and I feel strongly about that. You can't just assess yourselves. It's always helpful to have that external validation. But in the meantime, we all need to make sure we're continuing to assess and assure ourselves that our services are operating to a great standard.
What's that experience been like? Because you've obviously got the day job, but effectively you've ended up with this kind of extra job, if you like, of being able to support the CQC. And I guess because of your previous experience as an inspector, you've got the big group perspective, and then obviously your kind of previous role that gives you a really, really unique insight into all of that. Talk to me about what the last few months have been like, because obviously there has been this seismic shift. Some of it hasn't quite gone the way that well, I was about to say that the CQC would have hoped. I think the sector as a whole, including the CQC, would have hoped. I'd love to get into that a little bit more.
Sure. It's been an interesting time. I think that some of what we're talking about now are some of the things we were talking about a year, 18 months ago. So there's been an element of frustration around that. I think that CQC recognise they need to work in a co-productive way so that they involve the sector in what the guidance looks like. And there's a lot of talk about producing guidance, some descriptions around those ratings so that people understand what we need to strive for to reach good or outstanding. I think the sector's been missing that, frankly. We were used to the characteristics from before and we haven't got those now. So I've been meeting CQC just this morning to talk about exactly that issue. But it takes time. And I think that it's important to understand that there are a lot of players in all of this, because there's the Department of Health, there's the Secretary of State, various other groups want to have some engagement. And I think it's making sure that everybody's views are represented, and not least residents and patients, because at the end of the day, this is about making sure that services are providing good standard of quality of care for people. And the danger is we lose sight of all of that through all of this debate. So we're really keen to make sure that happens. And in fact, there's a number of us who are in the same position as me, who've been working for CQC in the past, who are in a similar role, either in big or small providers. And so we're all keen to make sure that we have a positive impact on what's going on and help CQC make some changes for the good. But hang on to the good stuff, discard the stuff that hasn't worked so well, but actually learn from that and move forward. But I think there's a way to go yet to achieve that.
Yeah, no, I can imagine. I think your point around not throwing out the baby with the bathwater is a really, really important one as well. One of the things that I was thinking about when you were describing all of that, in any care setting, you've got largely a team of people who are really, really committed, absolutely love what they want to be able to do, and they want to be able to push the boundaries, and they want to succeed, and they want to be able to have really, really clear direction around what does it mean, what does success look like. And I guess there's almost two different ways to look at that. So this is almost the two different parts to your role, of course, as being both the director of both regulation and the quality side of things. From a quality side of things, you've got we want to create our own benchmark, whether you call it outstanding or not, but that's kind of the ultimate aspiration. Then obviously you've got to make sure that from a regulatory perspective that you're doing all the important stuff that you need to be able to do there. People naturally need to have very clear direction around exactly what that looks like on both sides of the fence. And if you create your own standard of what outstanding, again, I'm using the word outstanding kind of more broadly, if you've got a framework for that you can get people inspired to be able to go and follow, that's brilliant. But then if it's lacking from a regulatory perspective, obviously there's gaps there, and that then leads to potentially, if there isn't clear direction, then that it can be a challenge for the people delivering the care. And you wouldn't want to make a misstep, because it's also important, because ultimately you're looking after vulnerable people, and nobody wants to make a mistake ultimately at the end of the day as well.
Yeah, that's a really good point. And I think, again, some of the debate we were having this morning about what does good look like, but equally, what does outstanding look like? And looking at some of the work that CQC have been undertaking so far to try and explain that, it's quite hard to differentiate sometimes between good and outstanding. So because in theory, outstanding should be pretty rare at times. And how do you define? And then that's the debate we've been having just this morning. I think that it's really important to start, as I said earlier, about with the regulations, because the regulations haven't changed. And if any action's taken against a provider, they're going to take that in line with the regulations. So that's a starting point. I think the quality statements and the sort of standards are not legal, they're guidance. And so it's important that CQC can provide some detail around that. And then we probably as providers need to then define that internally for ourselves. So what do our patients and our residents want and expect? Mm-hmm. We've done a lot of work with our business over the last few months defining what does good evidence look like. So we've encouraged our managers to pull evidence together of all the great case studies, the great practice. And we've had a lot of fun with that. We've enjoyed those stories and getting managers to just tell everybody what it is they're doing, showcasing what they do really well. And I think the other thing is what is good in or outstanding in one person's mind isn't the same somewhere else. And we do see that inconsistency sometimes across the country. We're a big provider. What happens in one area isn't necessarily the same in another. So what looks like outstanding in one place doesn't always isn't always replicated elsewhere. So that's, difficult to try and define that. It's a bit of a beauty in the eye of the beholder piece. But what we've tried to do internally as a business is try and define what we think that looks like. So, our own internal auditing focuses on, we call them blue ratings. So what is that exceptional practice? It doesn't have to be unique. It just has to be great. And so we've done a lot of work internally. So I think you can't rely just on the regulator. I think you have to determine your own standards and push for those. We've always had the adage that if we get it right for our residents and patients and satisfy what we need as a business, we will get it right for the regulators. Because quite often, regulators have been coming in looking at risk. So the good's gone out of the window. We're hoping that CQC will get back to looking at the great practice. There's a lot of homes out there looking for their ratings to be changed. And some of those homes, were good before, may not be so good now. Others requires improvement before and now looking, good or outstanding. So there's a lot of anticipation of CQC coming in to assess that. We all want that external validation, but because it's been a while coming in some places, we've had to look to what we do and what we expect from our services to define quality, really.
Nobody wants to deliver poor care. The aspiration is always, should always come from a really, really good place, I guess, without kind of having a really, really clear guideline around exactly what good and outstanding looks like. It's difficult. What I've seen, one of my old colleagues, a lady by the name of Sue Goldsmith, who's now the Chief Operating Officer at Belong, who have retirement villages up in the northwest. She was very, very, very diligent in how she created her quality and governance structure. She'd draw from all the various different insights. So she'd be looking at the key lines of inquiry, she'd be looking at the NICE guidelines, and that would almost inform her framework, her way of being able to operate. And I mean, I'd love to put both of you in a room at some point to really geek out on this type of stuff, because I think both Sues are powerhouses and amazing in their own individual right. But I think what I learned from working with Sue was just the importance of almost like building all of that into the fabric of the way that we do things around here. This is kind of our standard operating system. And it sounds like there's a bit of work to be done to get to that point where we've got what we need from the regulator for that to then be built into the standard operating system. Because again, nobody wants to have any gaps in the way that they deliver care.
No, I think that's a really fair point. One of the things that we've done at Barchester recently is we've developed a care and life enrichment framework. So
Amazing.
that basically sets out the customer commitments we're making around quality of care, and it is deliberately care and life enrichment. Our whole strapline is celebrating life. So we want people to come into our services and come and live as full a life as they can. So that structure, that framework we've put together is, it's underpinned by our people. It's overseen by our sort of quality assurance and continuous improvement processes. But in the middle is the people, or are the people. The people are at the center of what we do. And then that's supported by involving relatives and friends and family. It's about having great environments. It's about delivering great nutrition and a fantastic dining experience. And those sorts of things. So we've got 7 pillars. The given is that there's, safety at first, obviously, because people move into care homes expecting to be kept safe. So that's a given in our mind. We've got to make sure we deliver on that all the time. But we've actually spent time rolling that out across our business. It's now defines what we do. We're making sure we can measure that. And that's not defined by the regulator. It's defined what we believe our residents and patients should be able to expect from us. And we're going to hold ourselves to account over it. So absolutely, that's what we've been doing.
That's one of the beautiful things around creating, again, I call it an outstanding benchmark, and that's not a regulatory outstanding. That's kind of your version, the standard that you set. Obviously, you built that with the team at Barchester. The wonderful thing about setting that type of a benchmark is the fact that it's infinite. I think so you have to make sure that you're doing the things to be able to deliver everything that needs to be done for the regulator. But in some ways, that's kind of in a, I don't want to call it box ticking exercise because it's not that. But there are certain standards, obviously, that you have to be able to meet. So it's somewhat finite in the way that it operates. The exciting thing about having the benchmark is because it's infinite, you can just keep going with it as well. Like once you've achieved one really, really great outcome, you can learn from that and then keep developing it. And then that's just an onward cycle of hopefully upward trend of delivering really, really fantastic care.
Yeah, absolutely. And as you say, it has no boundaries. And from our perspective, it's about continuous quality improvement. So not resting on your laurels, continuing to learn from what you do. If it doesn't go right, put it right, sort it, move on. And I think, we're keen to make sure we do that. And we've got a framework in place. So we have a governance framework, we have a quality assurance policy. So those are the ways in which we keep ourselves in check. We test and assess that we're delivering the quality that we expect. And we don't just focus on what the regulators look at. In fact, people say my team go in and are tougher than the inspectors because they know where to look.
Sure.
And I think that's right. I think we should make sure that we scrutinise ourselves and what we do as effectively as we can. And for me, it's always been about making sure we're doing the right thing for our residents and patients. And we will satisfy the regulators once we've achieved that for ourselves.
Definitely. I guess if you set your sights over and above that of the regulator, even if you're not completely on form by the day, you'd like to think that you've still done all the important stuff to make sure that the regulators happy, which is obviously important. So obviously the set of circumstances with the CQC is what it is. It's not an ideal set of circumstances. In your mind, where do you see the biggest areas for improvement? What are the kind of the things that specifically that you've been speaking to the CQC about around, okay, so we all want this to work. What are those key things that you see as needing to change for this to be a more robust, cohesive, co-produced system?
I think one of the first things is they need to get out and get assessments or inspections completed. There are an awful lot of services sitting with historical ratings. So we've got some services that haven't had an inspection for 8 years. And in that time, you'll have manager changes, quality improvement or deterioration, potentially, hopefully not, but that's always possible in that time. And so we are sitting with ratings that are very old, and at CQC absolutely know that. And one of the big aims at the moment is to get across the threshold, get as much done. They are way behind on their targeted schedule by about half, and they're not going to achieve their targets for this year by their own admission. So what they are doing is trying to get out and do things more quickly. So we've been involved, one of our services has been involved in a pilot that's starting to roll out where they're trying to speed up the assessment. whether that's taking some of the work off the platform, not scoring the evidence categories, which is something they've said publicly that they are going to trial. And certainly that experience in our service last week was very positive.
Okay.
I think also they're trying to free up inspectors to not be constrained by the framework. And we certainly saw a very much more relaxed, involving process last week. And I have fed that back to CQC. It was very refreshing to feel that inspectors had the ability to say, well, actually, we will come back tomorrow. We weren't going to, but so many people want to talk to us that we'd love to come back and talk to them. So that was really encouraging. We had a very positive experience. I think the other issue is around how they're using those historical ratings, because certainly if they don't assess some of the quality statements, what they're doing is they are dragging those ratings through. Now, the commitment where it's an RI or requires improvement service is that they will look at all of the quality statements for that key question. But if it requires improvement, if it's good and you're looking for outstanding, if they drag it through too many of those old ratings, it will only ever be good. So interestingly, with this pilot, what they've been doing is looking at all the quality statements. So if they can get in and do that, you have a sort of clean bill of health, if you like. It starts again and you get a comprehensive review. Now, they have thrown some resource at that. We had 4 people on site last week, and I don't think that's sustainable. But what they're trying to do is experiment with how could we speed this up? They're very conscious they need to get through the door. So I think that sort of inspections and ratings are key. I think the work that they need to do next is also on defining what these ratings look like. And, we've been having some discussions with them about, their first thinking around this. And unfortunately, because the single assessment framework is a single assessment framework, it's trying to cover all things. Now, the review that's come out this morning from Sir Mike Richards suggests that that isn't sustainable, a single assessment framework. Even within social care, you've got services that provide care for people with LD and autism to older people's care homes, the business we're in, or people with dementia. And they are different animals. They don't work in the same way. And so you obviously, in our minds, need a set of guidance for all of those different scenarios, which will take time to produce. But there's plenty of us out there living and breathing this every day. And what we're trying to do is encourage CQC to draw on our experience, get these things written, get it out into the sector. I think the challenge with that is, of course, there's lots of reviews still to finish. What is that going to say about what needs to happen going forward? But I think there's a lot of consistency around what people in the sector want to see and what CQC are being called to change through these various reviews. So those are sort of the key agenda items, I think, right now.
Got you. That was my biggest concern when I heard that the single assessment framework was on the horizon, if you like, just the fact that it doesn't allow for the different provisions of care. And I can see why from an efficiency perspective, why that would be a favorable way to be able to go and do that. But although the context of the inspections might be similar, the kind of the content, the specifics are really, really different. And that, I guess it's not a surprise that that's one of the really key things that's being pushed back on at the moment. Putting you on the spot here a little bit, do you think they'll can the single assessment framework?
It's an interesting question. I think there's pros and cons. I think there's certainly direction today that suggests that is some of the thinking. I think it would be a shame to can it completely because, of course, there's been a lot of work gone into that. That's what they've set the stall out to do. And I think the logic of it was around the fact that people transition through a number of different services. So whether they're in a care home, they go into a hospital, they come back out. They may have started at home receiving domiciliary care, go into a care home. So I think the sense of why they did that is there. I think that it's been difficult to achieve. And I think some of the difficulty has been not having expertise. So there's talk of, reconfiguring now the structure of CQC. So as Sir Mike Richards has talked about, 3 chief inspectors, maybe 4 chief inspectors, which is where it was, going back to that clear line of sight through those various elements. So I think the chances are it will change. How far they'll go with that, I think it's difficult to say right now because it's such early days and it's a big thing to suddenly turn around. And it's like turning an oil tanker at times. You've got to shift the whole thing now. And that's a lot of work to make that happen, having changed it from distinct assessments to something that was consistent. And, you know, some of those assessments have been paused at the moment. There's talk of pausing the ICS assessments as well in the meantime, while all this thinking is still going on.
So which are the parts of the single assessment framework that you mentioned earlier, not throwing the baby out with the bathwater? What are the things that need to be kept, do you think, that could be really, really valuable going forwards?
So I think it's important to keep the voice of people in there, because at the end of the day, this is about delivering great care for people, whether it's residents, patients or others, and their loved ones, because they all have a say in this, as well as what healthcare professionals say. But I think it's important to actually test that with providers. So how are they delivering on that? There's always a context to what people say. It may not always be quite as people see it. So that's really important. I think it's really important to keep coming in across the front door. I think that one of the essences of the single assessment framework was they would be able to change ratings more frequently. Well, obviously that hasn't quite panned out just yet. And to do that remotely at times, I'm of the view that it's important to get across the threshold. I think there's nothing like seeing it, feeling it, smelling it, touching it, to get a sense of how a service is really operating and be able to just observe what's going on. And I think that's quite difficult when you don't do that on site. So I think that's important. I think the fact that the framework keeps the key questions, it keeps the ratings the same. There's a lot of talk about whether CQC will move to the Ofsted approach,
sure,
and remove some of those single-worded ratings. We all like the ratings. A lot of us as businesses use those ratings in various ways to measure how we compare with the rest of the sector. If you remove those, which some of the other inspectorates have done, it's quite difficult to do that benchmarking. We would like to know how we're competing against others, but it's, see how we fare. But I think by losing that, I think there's a risk that people don't understand quite how the service is operating. I think people like to know, is it good, requires improvement? But equally, there's a lot behind that. But I think the frequency, they've got to get in, they've got to keep that up. I think they've got to do as much as they can when they come in. I think we've seen inspectors come in and just look at a few areas and then leave other areas untouched. And so you've still got a bit of an out-of-date picture. It's really important that the public have the ability to read a report and use that to make a judgment about whether they're going to place somebody in a service, if they've got that choice, or feel happy about where their relative's been placed. So I think that transparency is really important. I think we had a lot of transparency previously with the regulator, and I think we've lost a little bit of that. So I would like them to go back to that, making sure the reports are understandable for people reading them and clear about what the service provision looks like.
Talk to me a little bit about single word ratings.
Okay, so we operate in 4 regulatory jurisdictions, and only one of those regulators uses single word ratings. So I actually, from a personal perspective, I think they're helpful because you get an overall picture of a service. How those multiple ratings wrap up into an overall rating, I guess, is another debate. But we also operate in areas where we don't get that overall rating. I think as a business, we quite like to see an overall rating for various reasons. But I do recognise that that's been quite controversial. If you take the example of Ofsted and the impact that has on an individual head teacher. And I think managers do take ratings quite personally, particularly the well-led rating, because it feels it's about them. But I think ratings, if they're good and outstanding, everyone loves them. Of course, if they requires improvement or inadequate, it's a whole nother story. So I think they're helpful. There's a lot of talk about whether CQC would remove that single word rating. And I think that's still to be seen, really. My preference would be to keep it, but I understand that it's quite emotive for people. And we'll have to see what happens next, really, with that.
It's another one of those things that we're going to have to watch that space on. So a lot of care providers have had bad experience of the CQC's portal. What's your experience been like, and what could you share? What lessons have you got from your experience?
Yeah, I think we've all experienced the portal. It hasn't been a great experience. I think that the intention was great, But again, the execution hasn't been so good. I think there's been a lot of technical issues with it. And I think that, and not just externally, but internally, I know that the inspectors use the portal to upload their evidence, and that's been challenging for them. But in terms of the intentions, the idea was that we would be able to submit information, we'd be able to submit notifications. And in fact, of the 4 regulators that we work with, it's the only one that hasn't got a fully functioning portal now. So, and most of our managers are registered with CQC. So we have 240 services registered with CQC. I've still got 80 managers who aren't able to access the portal at the moment. And that's been the case for some time. We've been working with CQC quite closely. So we spent time giving them feedback. We've had managers actually talking to CQC to talk through what they can or can't access. So we've been trying to help CQC test some of the fixes they've put in place. I think it does need an overhaul. I think CQC recognise that. And from our perspective, we can't actually see our whole estate at the moment. So as for the nominated individual, which is the sort of legal registered person for an organisation, the idea of the portal is that they could see everything. And at the moment, that's not the case for us. And I know that is the case. It isn't the case for other providers either. So there's a lot of work to do. We've got some people using it perfectly. So it's a bit of a mixed picture. I think it's difficult for large providers. There are limitations on the system, which again, we've been talking to CQC about how they address that, because we want to be able to look at what's going on across our estate. We want to be able to delegate access when managers are not around. That's still a bit of a challenge. And some of the processes like registration aren't working as well as they could. I think CQC are very sighted on the issues. There's a lot of intention to address those issues. My preference would be they suspend the portal while that work's going on, but they're not keen to do that at the moment. But they are looking at how they can address it provider by provider at the moment too, to try and sort out groups of providers to try and get them functioning as well as they can do. So ultimately, when it works, it'll be great because everything will go through on electronically, which is a much better place. That's the whole digitalisation programme in health and social care suggests this is the right thing to do. But also, longer term, we'll be able to submit information on the portal, be able to submit evidence. We won't just rely on when inspectors come in. The idea, longer term, was that we'd be able to send things to them and submit things following their request. So it will make all of that easier than having to scan and email and all of those sorts of things. So we all hope that we'll get to that point someday, and that is the intention. I'm sure it will happen, but it's a fundamental part of the changes with the digital transformation, and it hasn't quite worked as well as everyone would have liked.
Am I right in saying it's just the fact that the tech hasn't got the capability to deliver at the scale almost that it needs to? Has that been the kind of the underlying fault with the system itself?
I'm not sure I know what the fault is. I think that talking to their IT team a number of times, what's evident is that they were moving from a very old system to something that was sort of leaps and bounds ahead of that, but it's a big jump in one step.
Sure.
And I think that it's been cumbersome internally for inspectors to use. The factual accuracy portal, which is a sort of subset of that, is also quite clunky at times to use. So they recognise they need to make some changes there. So the technicality of it all, I'm not sure I understand enough to be able to comment, but definitely a lot of work needed to address it right now.
Sure. There's a concept that was taken from manufacturing that's now commonplace in the technology world called building an MVP, a minimum viable product, which is really where you take a very simple product, you take it to market, you get feedback from it, and then you iterate and improve on top of that. Now, I guess you could put the position forward that they were building an MVP and that they wanted to take the feedback and they knew that it wouldn't be perfect. I guess the argument from the provider end of the spectrum would be, well, it wasn't even nearly well developed enough for it to fulfill its expectations as a technology portal. So, I mean, maybe ever the optimist and looking at the world through a more positive lens. Hopefully, if there's been more co-production now around the building of the platform itself, actually the end result hopefully will be better in the long run, because if you build technology in silos and you don't speak to your customers as you're building it, that can cause problems as well. So hopefully there's a bit more of an open loop on that one where they're getting better feedback because of the problems, and that the end result will be better. hopefully.
Yeah, and I think you're right. And I did question whether it had been tested in a pilot mode, and I was assured it had been. But I think the reality would have been probably to have set up some dummy providers and test that. Now, whether that's actually what they did, I don't know. And I think that's been the issue also with the single assessment framework. So I think both those things probably hadn't been tested enough and probably needed to be tested with some reality and some feedback from people using it, because I think that some of what we see through the portal just doesn't make sense. For example, people need to deregister if they're a manager and they're leaving their role. But once you haven't got that email address that you're registered with, you can't deregister.
Sure.
So there's sort of glitches like that, which I don't think have necessarily been thought through as well as they could have been. And if a bit of testing with people doing it day in, day out probably would have helped if they hadn't done that. And certainly that's what they're learning from now.
For anyone that's listening to this that doesn't know, I used to run a management consultancy for the care sector. I used to spend an awful lot of time in care homes, and a lot of the time the care homes would be on a real journey that might be maybe from a bad to good, or maybe from a good to outstanding, whatever the set of circumstances might be. But I remember being in a care home that had, I don't think it was quite noticed for closure, but there had been quite a lot of significant things that had happened. There was new management involved, and it was a case of, right, okay, so we need to kind of rebuild the foundations. And obviously there's a whole big project that kind of almost underlies that. And one of the people that I was working with on that particular project was very, very pro having a roadmap and then being able to share that with the CQC just as much as possible. Not even if they didn't request it, it was almost like every couple of weeks or so, you'd basically say, here's all the progress, here's all the stuff that we're doing. We're taking this really, really seriously. We want to get this to being in a fantastic space. And it's a good indication to be able to say, like, we're on it when we're focused on the most important stuff. Is there an opportunity, do you know, with the platform to be able to keep the CQC up to date almost in that respect? Because I think the way that it had worked in this particular context that I'm thinking back to, it was the person that I was working with, they had a good relationship with the local CQC inspector and therefore had the email address so that they got that open loop already. Do you think is the opportunity to be able to drop in, like, here's a great thing that happened at this particular service with the technology, or is that something that doesn't exist yet?
It doesn't exist yet. I think that is the intention. I think you make a very good point. That relationship with the inspector is also something, unfortunately, we've lost at the moment through the changes that have been made. So we all used to have a lead inspector. We could pick the phone up to them, talk about the progress we're making, or say, look, you know, we're dealing with some issues and you may hear some noise around that, and just to give you some context to all of that. And I think we all miss that relationship. And I've had that conversation with CQC. I think they recognise that that's been lost a little. And I think the inspectors feel that they would come in knowing about the services. And I think that was an important part of, you know, that relationship you have ongoing. But also when they came in, it was familiar. They knew the people they were dealing with. And so we all are sad about the loss of that. I think there is some consideration about whether to bring that relationship piece back, particularly in the absence of the portal. We'd all love the opportunity to drip feed, because you're right, services don't recover overnight. They need time and investment. And you know, to be able to document that journey. So sometimes CQC will ask for action plans, but it's a piece of paper and it doesn't bring life to it. And I think that was the intention of being able to review ratings remotely or on an ongoing basis. The idea was if new information came in that made an inspector or an assessor think, do you know what, there's something different in here, either for the better or for the worse, that they would get in touch and either come in or just assess that particular area that they had more information about and see whether there was a difference and whether the rating could change. So that idea actually is very sound, but unfortunately, because they haven't been able to get into enough services, they're in the process of catch up at the moment. I think that was the longer term intention, and that would have documented that journey. You've been able to drip feed the things you wanted them to know about that were improving, and actually get them to come and have a look or do that remotely. Because some things you could do remotely, whether it's looking at documentation or having a conversation. So that was the purpose of this new framework, to be able to do that. And unfortunately, we've just lost all of that at the moment while they're playing catch up, I think.
Still a good bit of catch up to go. Is there a capacity issue, do you think, within the CQC?
I think there is a capacity issue. I think it's pretty well documented that they've been short in the registration team for some time. And that was before all of the rollout of this. There were shortages in the registration inspection team. That has been addressed. My understanding is they've recruited a lot of registration inspectors. So we're starting to see what were backlogs with registration starting to pick up. But there also are pockets of shortages across the country. And we know, it's no secret that there's been a poor staff survey internally. People are feeling a bit unhappy. And I think by their own admission, CQC would recognise that they need to do more to support their people. And they have lost people. So I think there are gaps across the country. But hopefully they will recover that with the changes that, potentially are coming. And people will feel encouraged. I think there's a lot of great people working at CQC who are trying to do the right thing. And actually, inspectors, having worked at CQC, inspectors join because they want to get out into services. Sure. And I think they've lost some of that. And I think the division into inspector and assessor roles meant that they lost some resource because some people sat behind the scenes doing all the intelligence review and others were out inspecting it. And that inevitably cut the resource on the ground. They've recognised that's an issue and they are considering what they do about that going forward because the feedback's been pretty strong around that.
What should care providers be focusing on to improve ratings? Obviously, we talked about the rating system quite a lot and the way that that's the landscape around that's evolving. But practically on a day-by-day basis for care teams, what type of stuff should they be focusing their efforts on?
I think it's important to be clear what standards you're aiming to deliver, as we talked about earlier, and making sure you've got assurance systems and audit systems in place to test that. I think it's really important that we self-assess, if you like, and understand that for ourselves that we're delivering what our residents and patients can expect from us. So I think it's important to have some sort of governance arrangements and assurance systems, whether it's audits on a day-to-day basis or monthly or whatever, to make sure that you're clear how your service is operating. It's really important to check in with people, find out what they think,
sure.
Particularly because of the focus that CQC has on what people say about services. I think it's really important to make sure that you're checking in with your staff. They are also another part of the people's voice element. And, quite a lot of staff I've spoken to during inspections and assessments. So it's really important that you're operating a good team culture. People feel able to speak up if there's issues, but able to contribute to improvements in the service. And I think it's important to make sure that people understand the framework and are able to demonstrate if they're on a poorer rating than they would like to be, but they're aiming to demonstrate their improvement, is gather that evidence, look at all the things that you've done since the last inspection or assessment or since the last incident, and think about what you've learned from it, what you do differently next time.
Conversation.
It's a really good question because probably a lot of people haven't ever been through an inspection. We've all been recruiting over the last few years with changes in staffing levels and new managers. We've got managers who've never been through a CQC inspection as a manager. So we're doing quite a lot of work internally to make sure managers understand the framework, make sure they know what an inspection looks and feels like, what to expect, how they can get ready, having a plan for the day. But we've also been spending some time starting to talk to staff about what to expect because they play a huge role on the day. In fact, what we're seeing is inspectors are keen to talk to staff more than they are to managers, actually. They want to understand, what does it feel like to work around here? What does it feel like, in terms of the relationship you have with your manager? What support do you get? What support does the company give the service, particularly if you're in a service that has more than one or two sister homes? So they're really keen to understand what people feel about the service when they're working there. So we've been doing some work talking to staff about what an inspection looks like, answering their questions, encouraging them to be able to speak to inspectors. I think quite often staff fear the inspectors coming in. They know it's really important that, you know, everyone's pursuing those ratings, and they feel a bit on the spot. They feel a bit afraid. So we're trying to encourage people to have confidence, to talk about what they're proud about. And testing that with them. So we've been sort of running those sessions and then coming back in unannounced and testing that. And that's gone really well. And staff have really engaged with this. But also getting them to think about the sorts of things they may get asked, and just thinking about what would they say if they were asked. How do you manage that situation when you're looking after a resident and an inspector asks you, can I just talk to you? And you feel like, do I look after the resident or do I look after the inspector? So our focus has been, you know, focus on your resident, but agree with the inspector when you'll go back and talk to them. So trying to get people to just feel at ease and be themselves, really.
That last point I think is really, really important. I remember going to 2 different care homes in one day, but earlier on in the daytime, I'd been in a board meeting, so I was wearing a suit, and the contrast and polarity between the first place that I went to, there was a look of like fear and almost like, oh gosh, are you from the CQC or any of that type of stuff? I was like, no, I'm just fill in the blank. However I framed it at that point, and you could see this kind of exhalation of, oh right, okay, that's fine then. But there was genuine fear in the eyes of the reception team, and I think there was maybe another team member there as well. And then the home that I went to later on, they jokingly asked whether I was from the CQC, and I was like, no, I'm not actually. I'm just here to see XYZ. And from an experiential perspective, from my side of things, the second home kind of gave me the impression that they got everything all organized because they felt very relaxed, and there was almost like a bit of friendly banter. The, oh gosh, who is this chap and why is he here type thing. That maybe it shouldn't do, maybe I'm being cynical, but that almost kind of raised a bit of suspicion. Is other problems that the CQC should be aware of. So I think we talked about being prepared both in the opening of this podcast and in the closing of the podcast as well. So Sue, you're an absolute wealth of knowledge. Thank you so much for your time today. It's been a lot of fun.
Thank you. Good to talk to you, Simon.